One of the largest and fastest growing job fields for women in the modern day is that in the medical field, with women many times being the heart and face of the industry. But this is a very recent occurrence, with women being barred throughout history from this field. Today we will be focusing on the role women had in medicine in the ancient world and how they were treated and viewed by their male colleagues, as well as how limited training and education hindered the health of women during and after childbirth. To begin with, women were not permitted to become doctors in all of ancient Rome, Greece, or Egypt. That position was solely given to men. Rather, women had two roles in medicine, with both of them centered around childbirth and the health of young kids. The two roles being that of midwives and wet nurses. This separation of male physicians and female physicians mirrors the social separation of men in the public sphere and women in the private sphere. The job of a midwife in the ancient world was by far and away the most important, as they were given the role of caring for the pregnant woman and helping them through childbirth, as almost always there was never a male doctor present, just a couple of midwives. This was because male physicians, and more to the point the whole male populace of the ancient world, had the mindset that women were prone to exaggeration and hysteria. Due to this, records and artifacts show that male physicians rarely, if ever, came into contact with female patients, believing that the issue was not worth their time. Now, the job of the midwife was to prepare the mother for her ordeal by positioning her in the most comfortable way and gathering supplies like towels, sponges, bandages, and such that will be used during the childbirth, and then when the time comes to help successfully deliver the baby while caring for the health of the mother. While there were no male physicians present at childbirths, the overshadowing influence of men was constantly present. Most notably, the midwives were usually trained and taught what to do by handbooks written by male doctors. The best example of this would be by the Greek physician Soranus in his book Gynecology. Much of his instructions called for the use of common sense and good observation skills to do the procedures, but the instructions for how to deliver the baby and help the mother with any health risks or concerns are very rudimentary at best. As rudimentary as in the ancient world, there was a very narrow understanding of the human body and even less of an understanding of the female body. And because of this, many treatments and medicines were based on home remedies and superstition. This is best expressed by the archaic ideas of spontaneous abortions and wandering womb syndrome. These ideas were formed from a lack of understanding of the woman's body and not caring to learn more about it. Men not being present during childbirth or with female patients caused them to lack hands-on experience and knowledge of how to treat them, and so they weren't the right people to write books on how to treat them. Midwives with experience were highly sought after and respected because with their knowledge they managed to save both the mother and child during birth more times than any man or woman taking instruction from man. But even with these midwives, things can go wrong for the mother. And this is where the wet nurses come in. These women, usually between the ages of 20 and 40, in their prime, raised and nurtured the children, especially for women who couldn't breastfeed because of health problems coming up from their childbirth. These women were just as valuable in raising of young kids as the mother, sometimes even more so than them. Women in the ancient world were given a very limited role in the medical sphere, and while small, they made up the most vital portion of it. The hands-on caring of women and children that men heedlessly forget about. But we in the modern era don't realize or respect the work women put into the ancient world. In the modern age, there seems to be a stigma associated with wet nurses and midwives, as they are looked down upon and judged. But truly we should respect their history and how they both saved the lives of women and kids, and progress medicine and the care of women.